Certified Nursing Assistant Test Questions and Answers. Question 1. The practical nurse is preparing to reconstitute a drug from powder for IM administration. Which step should the nurse implement first? Option A. Verify the drug with the medication administration record, MARCH. Option B. Mix the powder with the solution. Option C. Attach the needle to the syringe. Option D. Read the label to determine the amount of diluent to use. The correct answer is option A. Verify the drug with the medication administration record, MARCH. The first step in any medication administration is verifying the right drug, right dose, right client, right route, right time, and right documentation by checking the MARCH against the medication label. Question 2. When providing oral care for an unconscious resident, the nurse aide should position the resident. Option A. Flat on the back with head slightly lowered. Option B. On the side, lateral position, with head turned to the side. Option C. Sitting upright at a 90-degree angle. Option D. Lying flat with the head of the bed elevated. The correct answer is option B. On the side, lateral position, with head turned to the side. The side-lying, lateral, position with head turned allows fluids to drain out of the mouth by gravity, preventing aspiration into the lungs. The aide should use a soft toothbrush or foam swab and minimal fluid. Question 3. Which intervention should the practical nurse implement to help a client cope effectively with chronic pain? Option A. Administer around-the-clock opiate drugs. Option B. Give scheduled doses of benzodiazepines. Option C. Recommend avoiding painful activities. Option D. Encourage using relaxation techniques. The correct answer is option D. Encourage using relaxation techniques. Non-pharmacologic interventions like relaxation techniques, distraction, and guided imagery help clients manage chronic pain and reduce reliance on medication. Avoiding activities leads to deconditioning, not improved coping. Question 4. For an immobile client, which nursing diagnosis has the highest priority? Option A. Impaired gas exchange. Option B. FRISC for impaired skin integrity. Option C. FRISC for constipation. Option D. Activity intolerance. The correct answer is option A. Impaired gas exchange. Airway and breathing always take priority over other concerns. Impaired gas exchange can rapidly lead to death, while other diagnoses represent potential or less immediate threats. Maslow's hierarchy and ABCs, airway, breathing, circulation, guide this prioritization. Question 5. When providing range of motion, ROM, exercises, the nurse aide should: Option A. Move each joint to the point of resistance or pain. Option B. Move each joint through its full range, stopping if pain occurs. Option C. Avoid moving joints that have limited mobility. Option D. Perform exercises only on the strong side of the body. The correct answer is option B. Move each joint through its full range, stopping if pain occurs. ROM exercises should move each joint through its full, pain-free range of motion. If pain or resistance is felt, the aide should stop at that point and report to the nurse. Never force a joint beyond its comfortable limit. Question 6. The nurse aide is preparing to take a rectal temperature. Which of the following is correct? Option A. Lubricate the thermometer and insert 1 to 2 inches. Option B. Insert the thermometer without lubrication for accuracy. Option C. Position the resident supine, on back, for the procedure. Option D. Take the temperature rectally only if oral is refused. The correct answer is option A. Lubricate the thermometer and insert 1 to 2 inches. Rectal thermometers should be lubricated to prevent trauma and discomfort. Insertion is approximately 1 to 2 inches for adults, less for children. The resident should be positioned on the side, Sims position. Rectal temperatures are most accurate for core body temperature. Question 7. When measuring a resident's respiration rate, when is the best time to do this? Option A. Immediately after measuring the pulse. Option B. While the resident is talking. Option C. After the resident has been exercising. Option D. When the resident is unaware that breathing is being counted. The correct answer is option D. When the resident is unaware that breathing is being counted. Respirations should be counted when the resident is unaware. as people often alter their breathing pattern, consciously or unconsciously, when they know they are being observed. Counting immediately after taking the pulse while still holding the wrist is an effective technique. Question 8. A resident's dentures are found wrapped in a tissue on the meal tray. What should the nurse aide do? Option A. Throw the tissue and dentures in the trash as they are contaminated. Option B. Rinse the dentures in cold water and store them properly in a labeled container. Option C. Soak the dentures in hot water to sanitize them before returning to the resident. Option D. Leave them in the tissue on the bedside table for the resident to retrieve. The correct answer is option B. Rinse the dentures in cold water and store them properly in a labeled container. Dentures should never be wrapped in tissues or napkins as they are easily accidentally discarded. They should be stored in a labeled denture cup with cool or tepid water, not hot, which can warp them. Question 9. A resident with COPD is receiving oxygen at 2L/min via nasal cannula. The family asks why the flow rate is so low. The nurse aide should explain. Option A. The doctor is being cautious to prevent oxygen toxicity. Option B. High oxygen can actually stop some COPD patients from breathing. Option C. The resident prefers low flow because it's more comfortable. Option D. The facility limits oxygen to save money. The correct answer is option B. High oxygen can actually stop some COPD patients from breathing. Some COPD patients rely on a hypoxic drive, low oxygen level, to stimulate breathing. High oxygen flow can remove this drive, causing respiratory depression or arrest. This is a critical safety concept. Question 10. The nurse is assisting a client with diverticulosis to select appropriate foods. Which food should be avoided? Option A. Bran. Option B. Fresh peaches. Option C. Cucumber salad. Option D. Yeast rolls. The correct answer is option C. Cucumber salad. Clients with diverticulosis should avoid foods with seeds or small particles that can become lodged in diverticula, including cucumbers, seeds, strawberries, raspberries, and popcorn. Question 11. A client is admitted with influenza and vomiting for 3 days. Skin turgor is poor and mucous membranes are dry. Which finding is most important to report to the charge nurse? Option A. Weight loss of 4 lbs in the last 3 days. Option B. Hypotension and tachycardia. Option C. Nausea and anorexia. Option D. Dark amber urine output at 30 ml/hour. The correct answer is option B. Hypotension and tachycardia. Hypotension and tachycardia indicate hypovolemic shock from severe dehydration, a life-threatening emergency requiring immediate intervention. While other findings are concerning, they do not indicate immediate hemodynamic compromise. Question 12. A client is likely to tolerate higher pain due to Option A. Being a 55-year-old woman with moderate low back pain for 3 months. Option B. Being a 30-year-old man with first-time appendicitis. Option C. Being a 50-year-old woman with a new migraine. Option D. Being a 20-year-old athlete with an ankle sprain. The correct answer is option A. Being a 55-year-old woman with moderate low back pain for 3 months. Previous experience with pain and successful management increases pain tolerance. Chronic pain sufferers often have higher tolerance than those experiencing acute, first-time pain. Question 13. The practical nurse is adding tap water to several medications for administration via feeding tube. Which preparation should the nurse administer without delay? Option A. Reconstituted powder. Option B. Timed release capsule. Option C. Cherry-flavored elixir. Option D. Flavorless suspension. The correct answer is option A. Reconstituted powder. Reconstituted antibiotics and other unstable medications must be administered promptly after mixing to maintain potency. Timed-release capsules should generally not be crushed or given via feeding tube unless specifically formulated. Question 14. The nurse is making initial rounds on a client with a C5 fracture and Crutchfield TOMS. Which equipment should be kept at the bedside? Option A. A pair of forceps. Option B. A torque wrench. Option C. A pair of wire cutters. Option D. A screwdriver. The correct answer is option B. A torque wrench. A torque wrench is kept at the bedside to tighten and loosen the screws of Crutchfield tongs. It controls the amount of pressure applied to the screws and is essential in an emergency to remove the traction apparatus. Question 15. The nurse is performing discharge teaching on a client with diverticulitis who has been placed on a low roughage diet. Which food would have to be eliminated? Option of roasted chicken. Option B, noodles. Option C, cooked broccoli. Option D, custard. The correct answer is option C, cooked broccoli. Cooked broccoli is a high-fiber, roughage, food that should be avoided on a low-roughage diet. Roughage foods increase bowel motility and can exacerbate diverticulitis symptoms. Question 16. The nurse is caring for a client following transsphenoidal removal of the pituitary gland. The nurse should be particularly alert for which complication? Option A, nasal congestion. Option B, abdominal tenderness. Option C, muscle tetany. Option D, oligoria. The correct answer is option A, nasal congestion. Transsphenoidal surgery approaches the pituitary through the nose. Nasal congestion can further compromise the airway, which is already at risk from surgical swelling and packing. This is a priority nursing concern. Question 17. The nurse is preparing to administer an enema to an adult client. The nurse should place the client in which position? Option A, supine with head elevated 30 degrees. Option B, right side lying with legs straight. Option C, left Sims position with upper leg flexed. Option D, prone with a pillow under the abdomen. The correct answer is option C, left Sims position with upper leg flexed. Left Sims position, left side lying with right knee flexed toward the chest, allows the enema solution to flow by gravity into the sigmoid colon, improving effectiveness and comfort. Question 18. A 4-year-old asks, will it hurt before tonsillectomy? What is the best response? Option A, it may hurt, but we'll give medicine to help. Option B, no, you won't feel anything. Option C, yes, it will hurt a lot. Option D, I don't know. The correct answer is option A, it may hurt, but we'll give medicine to help. Honest, developmentally appropriate, and reassuring responses build trust. Telling the child it may hurt but that medicine will help prepares them without causing excessive fear. False reassurance, B, breaks trust when the child experiences pain. Question 19. The nurse aide is caring for a resident who has a stage 3 pressure ulcer on the coccyx. Which positioning aid is most appropriate? Option A doormat cushion. Option B, a rolled towel placed under the coccyx. Option C, a gel mattress overlay. Option D, a foam wedge under the knees. The correct answer is option C, a gel mattress overlay. Pressure redistribution surfaces like gel or foam mattress overlays reduce pressure on bony prominences. Doormat cushions are no longer recommended. They cause venous pooling and pressure at the doormat edges. Wedges under knees can be used but don't directly relieve sacral pressure. Question 20. The nurse aide is preparing to measure a resident's blood pressure. Which action could cause a falsely high reading? Option A, the cuff is too wide for the arm. Option B, the resident's arm is supported at heart level. Option C, the cuff is wrapped too loosely around the arm. Option D, the resident is seated quietly for 5 minutes before measurement. The correct answer is option C, the cuff is wrapped too loosely around the arm. A cuff that is too loose can cause falsely high readings because it requires more pressure to occlude the artery. Other causes of falsely high readings include a cuff that is too small, the arm below heart level, or recent activity. Question 21. When helping a resident who has right-sided weakness to put on a shirt, the nurse aide should: Option A, put the right, weak, arm in first, then the left, strong, arm. Option B, put the left, strong, arm in first, then the right, weak, arm. Option C, allow the resident to dress independently without assistance. Option D, use only button-down shirts for ease of dressing. The correct answer is option A, put the right, weak, arm in first, then the left, strong, arm. Dressing begins with the weak or affected side first, then the strong side. This makes the process easier and less painful. When undressing, remove the strong side first, then the weak side. Question 22. The The nurse aide sees another aide hitting a resident. What should the aide do? Option A, report the incident to the charge nurse immediately. Option B, mind their own business to avoid conflict. Option C, confront the other aide in the hallway. Option D, tell the resident to report it themselves. The correct answer is option A, report the incident to the charge nurse immediately. Witnessing abuse is a mandatory reporting obligation. The aide must report the incident immediately to the charge nurse or supervisor. Failure to report is a violation of law and professional ethics. Resident abuse can result in criminal charges and license revocation. Question 23. A client with cancer refuses to allow an 4-4 chemotherapy and says she wants to go home to die. What is the priority nursing action? Option A, evaluate the client's mental status for competence. Option B, notify the healthcare provider for discharge orders. Option C, initiate a DNR order. Option D, document the refusal. The correct answer is option A, evaluate the client's mental status for competence. Competent clients have the right to refuse treatment. The nurse must first assess whether the client has decision-making capacity. If competent, the refusal is respected. Other actions follow based on competence determination. Question 24. The nurse is caring for a client who begins to have a tonic-clonic seizure. What is the priority nursing action? Option A, insert a padded tongue blade. Option B, restrain the client's extremities. Option C, protect the client from injury. Option D, administer diazepam for push. The correct answer is option C, protect the client from injury. The priority during a seizure is protecting the client from injury by moving furniture, padding the environment, and guiding the client to the floor if standing. Tongue blades and restraints can cause injury and are contraindicated. Question 25. The nurse is visiting a home health client with osteoporosis who has a new prescription for alendronate, Fosamax. Which instruction should be given? Option A, rest in bed after taking the medication for at least 30 minutes. Option B, avoid rapid movements after taking the medication. Option C, take the medication with water only. Option D, allow at least 1 hour between taking the medication and taking other medications. The correct answer is option C, take the medication with water only. Fosamax must be taken with a full glass of plain water only, not juice, coffee, or other beverages, to ensure absorption and reduce esophageal irritation. The client must remain upright for 30 minutes after taking it.